to accept the September meeting minutes as reported. Made by Josh. Second by Dick. Any discussion? All in favor say aye. Those opposed say nay. Motion carries. We have a presentation today with Nick Garrido, Capital Project Slideshow.
I just want to start to say thanks for letting me just show some progress shots of the entire project so far. I'll start at the new wash bay facility. There's quite a bit of progress down there for this particular building. This photo here shows the foundations going in. Looks like this is right after they poured the walls. They have foundation walls, footers are in before they strip the forms and backfill the walls. This is also the wash bay. Here is the masonry blocker up. Concrete deck is set, and this is actually right in the middle of the slab pour for that building. This is after they put the mezzanine up for washing the trucks. The heating system is also in, the plumbing, roof drain is also in there in the middle. They are just about done with this mezzanine now. Interior slabs, it's all poured, secured, grates are in. This is pretty close to where they are now as far as the interior of this the wash bay facility. And this is basically a current shot of the exterior of the building. The roof's on. The square face brick is on the just waiting on insulation and the metal siding, which is on site. It's just most of the focus is up at DSS right now, trying to get that building close, but all the materials are on site. Bollards are up around the building there. Basically now the thing going on in that area is underground electrical services are starting to lay out, and their pole boxes are over there. Next building I'll go over to is the cold storage building. This is a little less progress than the wash bay facility. This is a picture actually from on top of I was standing on top of the wash bay there and got a shot at the whole foundation. This was pretty early on in the foundation work there. As you can see, they're building walls, foundation walls. This is again right in the middle of the slab pour. They used a pump truck to pump all the concrete to the slab. I believe Mike told me that it would be 189 yards to pour that concrete slab.
How long did it take them?
They were done pumping trucks by 10:30. They left that night about 7 o'clock is when I left. Just from finishing it.
Wow.
And,
Impressive.
we got winds the right direction, so no leaves. That was a big concern for everybody. Was the wind and the leaves coming on there. They didn't want the leaves on there, so the leaves were coming.
Yeah, they kind of screw with all the problems.
So
You didn't invite all of the legislators down and put our initials in there?
there's one more to go.
There's one more to go.
You get to put your name on
You
it.
gotta put it on the top.
And then this is actually the day after the slab pour there. It turned out real nice. It's pretty much what it looks like right now, just not wet, obviously. But they did the 4-foot outside walls there, most of them around the back side, and bollards are up as well on this building here. All right, next is the highway garage. A little less progress here too, but pretty much right where it's supposed to be. This is them early on in the summer, clearing the lane, clearing all that dirt out of the way, and they're starting to build that mountain there on the side. And it's pretty much stayed like that until recently. This is from the other day where they're starting to box out all their footers for the foundation. That's actually scheduled to get poured Thursday, maybe Friday, depending on the weather.
So that's gonna be block, it's not gonna be a poured wall, or is it?
No, they're gonna pour that.
Okay.
They're just forming the footer boxes right now. The rebar guys they're on site tying all the rebar right now. And Thursday weather-wise isn't looking great, but they're gonna pour the majority of the footer on Thursday. And they leave a section out like they show on this one here. They'll leave that out so they can get in and out, and then they end up filling it all in at the end. They fill it so it's channeled right into each other. All right, this is DSS. This is right in the beginning when they were demoing. They went in with a mini excavator and just ripped down all the walls after they turned off all the power and turned off all the water. And they had a good time going in there and smashing stuff and getting it out. This is actually the new boilers in the boiler room. Boilers are all set, pumps are all in. Next week, the water's gonna hopefully get tied in gas, so we can start using once the building's enclosed, there'll be permanent heat in there, which really will help with interior finishes. So this is the interior of the DSS building. On the floor there, I don't know if you can see or not, but each room is laid out with a room number for the entire building. It's all the rooms are all laid out. And there's also, they poured all the piers for the rooftop units for the additional steel, structural steel that goes in there to carry the units. That outside wall, it's blue, all the insulation's on the outside walls there. They chose those corners because that's the windiest part of the building, so they're trying to cut the wind out, and that's where they started. This is the exterior of DSS right now. They're starting the masonry, they're starting the masonry brick on the outside. It's going kind of slow right now, the brick is, but it's the first day they're on site to get all the layout figured out. But in general, the outside is moving fast. They want to get the interior studs here standing up next week, hopefully, is what Betty Green was telling me today. This
Where do
is
they end up going with the roof drains?
they're
They come out next year like the old ones did, or?
they're tied into the whole system.
They are.
He hasn't done them yet.
Yeah.
Actually, Friday is the outside walls are tapered into it, and the peak. Everything goes
Sorry
into
for
that. Okay. This is new maintenance garage. It's right next to the DSS building. This is pre footer porous. This is when they formed it all up. This was a while ago. And there's the piers on the outside for that overhang, and then your foundation forming. This is after they framed up the whole building and got the plywood started up on the outside there. That actually only took about 2 days to set all those trusses. They moved pretty quick. Interior framing, these are your interior walls, 2 bathrooms, offices. Everything's framed right up, waiting for rough-in. They just did this the other day. So this building's ready to finish the interior. Windows are in. I don't know if you can kind of tell it not there, but your windows are already in the building. This is what it looks like from the outside. Same thing as the wash bay. Roofs on, split faces on. Just waiting for the insulation and the metal panels that are on the outside. Everything's on site. The focus is mostly on that DSS building and getting foundations in at the highway garage. And that's it. Anybody have any questions?
Thank you.
If anybody wants to go take a tour, go inside any of these buildings, go look at everything, let me know. We'll connect with Nick and we'll head over and go look at it.
Thank you. Thanks a lot. Now we'll move on to the dockets.
Okay, the first docket is authorizing agreement between the County of Lewis and Chimera Integrations LLC for replacement of existing access control security panels and replacement of power supplies in the courthouse building at a cost of $20,017 with such services to be completed by December 31st, 2023.
Any discussion? All in favor say aye.
Aye.
Opposed say nay. Motion carries.
Accepting fiscal year 2022 SHSP grant award provided by U.S. Homeland Security and FEMA in the amount of $46,946 for the period of September 1st, 2022 through August 31st, 2025, and appropriate funds.
Any discussion? All in favor aye.
Aye.
As opposed nay. Motion carries.
Approving supplemental agreement number 1 to the contract between County of Lewis on behalf of Lewis County Highway Department and Foyt Elbert Architecture, Engineering and Surveying for the bridge replacement on West Road over Whetstone Creek for additional wing wall design, right-of-way coordination, and bidding for the permanent easement at a cost of $16,400.
Any discussion? All in favor say aye.
Aye.
As opposed say nay. Motion carries.
Accepting 2022 through 2023 New York State Division of Criminal Justice Grant Award for certified pretrial services through the Probation Department in the amount of $60,000 for the period of April 1st, 2022 through March 31st, 2023, and appropriate funds.
Any discussion? Ryan, I know you told me what this was for. What was that? I can't remember.
So pretrial services are more important than ever now that we have bail reform, right? So there's a lot of more time often between the trial. And so we try to work with folks post-arrest, pre-trial to get them on the straight and narrow. The state obviously feels an obligation to assist with that. We've been doing it here in Lewis County for years, but this is new money to help us provide better services.
All in favor say aye. Aye. Those opposed say nay. Motion carries.
Authorizing agreement between Lewis County Solid Waste and Chimera Integrations for camera security equipment and installation services at Lewis County Transfer Station site for a total cost of $13,405.
Any discussion? All in favor say aye.
Aye.
Those opposed nay. Motion carries.
Appointing the following members to the Traffic Safety Board: Stephanie Hauser-Faust, Judy LeBrake, Melissa Keneally, and Samantha Brown.
Any discussion? All in favor say aye. Opposed nay. Motion carries. I see we don't have any motions today, correct?
No, we do not.
Any other business to bring before the committee? If not, can I get a motion to adjourn? Made by Dick. Second by Josh. All in favor say aye.
Aye.
Those opposed nay. Motion carries, and I think that's a record.
That's pretty good.
Be to order. I'll make a motion to approve the November 20th, 2022 Health and Human Services Committee meetings, if I could get a second. Nick. Presentation today from Ashley Wake, who's Public Health Director, on the public health assessment.
All right, can we give you,
Switch.
oh, yeah, sure, great, thanks.
Not sure you can trust that.
That's a first. I love that.
It's a first.
I know that.
Oh, it's called.
Can I steal your chair?
Not my phone.
Okay. Phil, you are having a day. Okay, I am here to talk about the 2022 Community Health Assessment. This is, every 3 years, public health has to go through a community health assessment and a community health improvement plan. So today, we will talk about the community health assessment. Next month, we will talk about the improvement plan. So some of you may not be familiar with what a community health assessment is. It's exactly as the name says, it's an assessment of our community's health. It gathers data from a variety of sources. It assesses health behaviors, our environments within our communities, health equity, access to care, and health outcomes. It is a requirement of every local health department to do this every 3 years. And that is tied to our Article 6 funding. So what do we do with the assessment once it's done? Well, it's used to inform our community health improvement plan. We analyze the data and pick top health priorities to focus on. We use it to inform our other public health activities that we do under Article 6 state aid. There's some that we have to do, but there's some that we have the option to do that are also covered under that funding. So based on health outcomes, we might choose to do one activity over the other. And then other community-based organizations utilize the data in their own planning as well. And the data is used for grant applications. So where does the data come from? Vital records, medical records, insurance claims, many surveys, which are done on a national, state, and local level, and then the U.S. Census Bureau. We also locally, meaning Jefferson, St. Lawrence, and Lewis County, have a community health survey that's conducted annually by JCC Center for Community Studies. And just this year, we did a health improvement survey ourselves. We recognize that coming out of the pandemic, a lot has changed, and we wanted a little more feedback from our community in regard to what's an issue for them, where do they have barriers to seeking care, and what's important to them to improve their health. A little bit on the prevention agenda. So this is the state's health assessment and improvement plan. It informs all local health assessments and improvement plans. We basically work within their framework. This started back in 2008. There's 5 priority areas. Number 1 being prevent chronic disease. Number 2, promote well-being and prevent mental and substance use disorders. Promote healthy and safe environments. Promote healthy women, infants, and children. And then prevent communicable diseases. You'll see in the charts that I handed out that the health outcomes are broken down into those 5 priority areas. So over on the left-hand side, you have the priority area. The next column is the indicator, so that's specifically what we're talking about. For example, the top row is adult obesity. The next column is the prevention agenda objective, so that's their goal. That's where they want us to be. We have 3 columns of our current data, which is the 2017 to 2019. Yes, I know that's old data. That is the most current. And unfortunately, as of right now, that's, and always historically, that's what we have to work with. And then the two previous cycles data there. So we compare to ourselves historically. The second to the last column there is the Tug Hill region. So that's where Jefferson, St. Lawrence, and Lewis County are together. So we compare ourselves to the region. And then the last column is New York State data. So we also compare ourselves to the state. I'm not going to go through every data point here. I am going to highlight some of the most important throughout the presentation, but you do have this in front of you to review. I will tell you the dark blue are areas where we are not meeting prevention agenda objective, and we're also doing worse than state. The green is we're meeting the prevention agenda objective, we're doing good. And then there's yellow, you'll see here on this, on the second half of it. Those, we are doing better than the state, but we're still not meeting the prevention agenda objective. You'll see under women, infants, and children and communicable disease, specifically, we have much more green than under chronic disease, which is a good thing. We're doing well with those health outcomes here in Lewis County. Women, infant, and children had been something that we concentrated on for several years prior to me being director. And our health outcomes have improved in these areas. So what's been the focus for the last 3 years? Adult obesity, which we focused on since 2014, childhood obesity, again since 2014, and suicide. Adult obesity. So currently 38% of adults in Lewis County are obese. When you factor in overweight adults, that jumps to 69%, which is higher than the statewide average of 62%. We're far worse than the New York State Prevention Agenda goal of 24%. And I think something else that's very worth noting is that when you pull out adults with an annual household income less than $25,000 a year, the obesity rate jumps to 55%.
So on that, people without any money are still eating maybe the wrong foods, but
They don't have access to fresh nutritional foods, so they get their groceries at places like Dollar General. So it's processed, it's high in sugar.
They don't have opportunities to go to the gym. Maybe their lives are living from one stressful event to one stressful event, not having enough money to give themselves a less stressful life. Stress leads to obesity, poor nutrition leads to obesity, lack of exercise, maybe lack of education regarding what they should be doing to improve their health.
it's just interesting that, raw food, unprocessed food, potatoes, carrots and stuff, are monumentally cheaper than buying processed food at the dollar store, but they don't include that.
Not necessarily. You can buy a package of, cookies for $2, but a carton of strawberries is $6.
Right, or ramen noodles, or the quick dinners. And yes, potatoes and corn and those starchy vegetables are cheap, but the green leafy, which are actually better, are a bit more expensive.
And if you have 2 jobs, it's hard to cook those meals.
So lots of things that factor into this. As far as childhood obesity, we are at 23%. I forgot to say this, but we're the blue line on this graph, and New York State is the green line. Obviously, with a smaller population, we will be more volatile in our ups and downs. But it's important to note that we've steadily been above the statewide average. When you account for overweight in children, the rate jumps up to 41%, which again is higher than the statewide average of 33%. And again, we are far worse than the goal of 16.4% that the state has set.
Actually, it's been a while since we looked at this data, but I remember, for whatever reason, this has stuck with me, whether it's true or not. But I thought there are years in which Lewis County actually is number one in the state for obesity.
We're not there this year, but yes, there have been past years. We are number one for suicide, unfortunately. And while rates are higher among our other rural counties, Lewis County is the highest suicide rate in the entire state as of right now. So as of,
It's per 100,000.
yes, it's per, yes.
So we only have 26,000.
Yes, that absolutely factors in. So right now, our 22 per 100,000 is the last official data. That's from 2018. That's about 6 suicides. 2019, we had 7. In 2020, we had 4. And in 2021, we had 3. Again, we're far worse than the prevention agenda goal there. So needless to say, these 3 priority areas are going to remain priority areas for us moving forward. Some work did get done in regard to our community health improvement plan, but I will tell you much of it was delayed or put off during the pandemic. So looking at the next 3 years, some things that stood out to us and members of the Lewis County Priorities Council. This is the group that we look to for input in regard to this. Quite frequently, these are the individuals that we partner with to get this work done. The priority areas that stuck out were binge drinking, smoking, and falls, resulting in hospitalization. Binge drinking data, 32% of adults as of 2018 were reporting that they were binge drinking. This data is prior to the pandemic, which has been thought to worsen since the pandemic. So we could anticipate that this line will continue to trend up. Our community survey that's conducted by JCC in 2017, 39% of community members reported they never drink alcohol. In 2022, that's dropped to 17%. While the number who report drinking alcohol more than twice per week increased from 11% in 2017 to 20% in 2022. So those are pretty dramatic increases. And again, far worse than the prevention agenda goal of 16%. And far worse than the state, where we used to be better than the state. Adult smoking, this surprised me. I honestly thought that our smoking rates were improving, not only here in Lewis County, but you can see the green line, New York State is trending down. Unfortunately, we've taken a turn for the worse, and we're trending up. Again, from an equity standpoint, when you pull out adults with an annual household income less than $25,000, the smoking rate increases to 22%. Right now, it's 18% for the entire adult population.
Ashley, is that the vaping? Or is it
It's cigarette smoking.
cigarettes?
Cigarette smoking, yes. And it's only adults, so it's not even factoring in the vaping among youth. So there's a couple of things that I think we need to better understand. Are these individuals that started vaping as teens and are now adults and are converting to cigarette smoking? I think there's more to understand here, but nevertheless, it's something that we had focused on in the past, and I think we need to bring back a focus on this before it gets out of control. And our other two counties do focus on this.
And to clarify, that says when you pull out the low income people, the smoking rate goes up, so it's higher
Among low income.
would it be the other way around?
Nope, so when you just look at individuals with a household income of less than 25,000, the rate jumps to 22% from
Oh, I'm sorry,
18 among
so
the
pulling
entire,
out, you're saying you're looking just at.
just at those,
12,000,
yes.
okay.
Yeah,
You can
sorry, I
pull
guess I
out
should have worded that.
That's okay, thanks for the.
And then hospitalizations due to falls, which this has not been something that we have focused on before in the past. But as you can see, we are trending up. Traditionally, it's been something that we've done better than the rest of the state with. We are now right where the state is, but worse than the prevention agenda goal, which is 174 per 10,000 population over 65. We're currently at 194 falls per population of 10,000 over 65. That's about 98 falls a year resulting in hospitalization. So there's many interventions that can be done in regard to strengthening balance and muscle. A lot of it is education, and that would work to reduce the falls among our older population. Next steps. So we will be looking back at the last 3 years' interventions, assessing what's been effective, what hasn't, what we haven't even started, and then researching new evidence-based interventions, and all of those are listed in the prevention agenda. We'll continue to work with our community partners, mostly the Priorities Council, to establish our interventions, timelines, goals for the next 3 years. This all needs to be written out and in the plan and to the state by the end of the year. I welcome any feedback that you all have to incorporate into the plan. And I do plan to come back here in November with the proposed interventions that we would be implementing for the next 3 years to work on these priorities that I just spoke about. Any questions, feedback?
Thoughts on how we recognize the effect of COVID in the last 3 years, and then the economy that we've got now, where the prices are through the roof on everything, how that's going to be affected here with the income? I don't know how you do it, but I would think the numbers would be skewed if you then compare them to non-COVID years.
Right, so, well, we know COVID is going to impact especially our chronic disease. A lot of care was delayed during the pandemic. People were at home, less active, maybe not eating as healthy. So we know that is going to have an outcome on our health indicators. And the economy. I mean, we have a couple of indicators with evidence that those with lower incomes have worse health outcomes. So with inflation, that will have an impact.
That's what I'm saying.
Yes. What that will be, number-wise, I don't know, but yes, it will have a negative impact.
Could you speak about the clinic that you had on Friday?
Yeah, We had a really good turnout. Sorry, I don't have my numbers
No,
right in
that's,
front of me.
I know, put me on the spot.
We gave over 500 vaccines. And unfortunately, we ran out of COVID boosters. We didn't know what kind of response we were going to get from the community, but it was very good. So we have ordered more. I would anticipate, they tell us they'll be in within 2 weeks. So typically it's within a week, but I don't know. I also know that our pharmacies ran out as well. So I think the community is wanting the booster. Also a really good response for the flu shots, which is equally as important this year.
So are you scheduling clinics on every Friday or is it sporadic or?
It's going to be, as soon as we know the vaccine is going to be here, we're going to schedule another large community clinic. We'll see what the response is for that and plan accordingly.
So will you always do it here in Lawville, or are you gonna spread out in the county?
We will do the next one here in Loudville, just because we still have the demand, but we do plan to go to the north and the south.
Would a place like JCC have no parking in what's at the fire hall? Because if you go through the fire hall in the morning about 8:30, there aren't many vacant spots. The clinic people, the rest of it. I just don't know if that would work for you or not, but it just seems to be more parking down there than it's left over here. Just a thought.
We don't really have any big rooms there like they do in the firehouse.
Well, that one workshop at JCC is pretty good sized.
We were
Trying
trying
to
to
be equipment departments in there now.
Yeah, oh, is it?
there's no tables or anything.
Yeah. Okay. So I can't imagine any other place with bigger parking lot either.
Other fire departments, out of the
Out of
village,
the-
Right.
yeah.
just out of the village.
3G is a big parking lot.
Yeah.
Green.
Yeah, we could absolutely look at that. I know it was a little backed up there, especially at the beginning.
But you did good, you ran out of everything, so you had enough parking for what your supplies were, so that was good, yeah.
Thank you for doing that.
Any other questions for Ashley? It's clear that a ton of work goes into this and, you know, it's vitally important. I think the statistic was for every, like 7 cents for every dollar spent on prevention, you know, health. So this really highlights the need for it. It's important work, so thank you. Oh, okay, moving on to docket, Cassandra.
The first one is authorizing renewal agreements between Lewis County Community Services and Coordinated Care Services, Rubensahl, Knudsen and Associates, and Mental Health Association in Jefferson County for the period of January 1st, 2023 through December 31st, 2023 for continued program services.
Any discussion? All in favor, say aye. Opposed, nay. Carries.
Amending compensation plan with reference to Lewis County General Hospital to create one part-time clinical laboratory technician position, salary $26.46 to $33.81 per hour.
Any discussion? All in favor, say aye. Opposed, nay. Carries.
Reappointing Ms. Karen Rennie as a member of the Lewis County General Hospital Board of Managers effective November 2nd, 2022 through December 31st, 2023.
Any discussion? All in favor, say aye. Opposed, nay. Carries.
Authorizing renewal agreements between Office for the Aging and McManus Hotel and Osceola Outpost LLC for the period of January 1st, 2023 through December 31st, 2023 to provide senior meals for the nutrition program and to continue the evening meal program at Maple Ridge Center facility.
Any discussion? All in favor, say aye. Opposed, nay. Carries.
Authorizing amendment to existing agreement with Adirondack Central School District and Lewis County Public Health Agency for child transport services at a rate of $482 per day.
Any discussion? All in favor, say aye. Opposed, nay. Carries.
approving the 2022 resource allocation plan with New York State Office of Children and Family Services in the amount of $29,376 for comprehensive planning for youth services.
Any discussion? All in favor, say aye. Opposed, nay. Carries.
Supporting Operation Green Light in recognition of active military service members and those in transition to civilian life, and declaring the week of November 6, 2022 through November 12, 2022 as a time to salute and honor the service and sacrifice of our men and women in uniform.
Any discussion? All in favor, say aye.
Aye.
Opposed, nay. Carries.
That's all I had.
I don't think we have anything else for today. I'll make a motion to adjourn. I'll get a second.
Second.
Thank you. We're adjourned.
Call the meeting to order. Ryan, please take note of the previous two meetings. On behalf of Tom, I'm telling him, make it concise.
Phil, I'll jump in right there. First pitch is at 4:07, so I think he'll be pretty quick. Even though he doesn't have 2 hours.
Go Yankees.
Go ahead, Ryan.
Probably have to do the minutes.
Do we have a motion to approve the minutes of the September meeting? Jeff and Josh. All in favor?
Okay, 2023 budget. The reason that we went so fast the other 2 meetings is so that we could take our time to discuss budget, but we can move through it as quickly as possible.
Can we vote on that?
You can vote on anything. Well, I don't know how this got in there. All right, let's just review the budget process where we are today. This is a process that begins actually back in August. Eric and I start meeting with department heads. Last month, we brought forward some of the larger issues, right? So we already talked about the capital budget. We already talked about, creating and eliminating positions. We talked about all that last month. Today, the 18th, is the budget workshop. We will have a tentative budget printed and on your desk when you walk in to the board meeting on November 1st. And then we have our budget hearing, and that's on the 22nd. Anytime after that, you can adopt the budget. In some years, it's been amended. It gets adopted in December. As long as we adopt it before the 1st of January, that's how it works. So the purpose of the budget workshop, this is just a preview of the tentative budget. It's about consensus building. I don't want to put something in the budget that you all aren't going to like. So let's make sure we're all on the same page. This is an opportunity for questions and input. We can always do more workshops if that's, something that the board would like. And really today we're trying to focus on the broad strokes. I did take the comments to heart last year. We do not have slides of every single department. So we tried to cut it down to only 30 slides instead of 80 something. So I think we got to zoom out a little bit this year because the way we're looking at budget in 2023 is a little bit different. We want to talk about those two buckets that I'm always preaching. We want property tax and sales tax to fund our county operations. We don't want to use pilot funds. We don't want to use excess sales tax money that we can't count on year to year to fund our operations. Our operations need to stay in that bucket of revenue that we can count on. We're going to go through, some things of our fund balance and sales tax are doing quite well. We want to make sure this year we're not pre-charging residents for expenses that might not occur. So we've run a pretty conservative budget in the past where we would really inflate costs to make sure we had enough money. In an environment where we've got a good fund balance and sales tax money is coming in strong, I don't think it's appropriate to try to inflate those things. I think we actually want to cut the other way this year. We want to be more conservative about, what we're putting on the taxpayers ahead of time, right? Because once we pass that levy, the bills go out, we can't take that, that's money that we've brought in. We want to rely on fund balance for unforeseen expenditures and one-time projects, which we talked about last month with the West Road culverts and the PSB parking lot. And we want to rely on a risk pool instead of incorporating potential expenditures in the budget. And we'll talk more about that. Examples are Medicaid, IGT, and payroll. So fiscal targets, big picture. This is what the board's been looking at and working towards since 2015. 13 million is no longer 10% of our county operations, but you get the point. We've got a minimum fund balance we try to maintain. Even with the debt we've taken on last year, we still have a great credit rating, and we obviously are not cutting any services, nor are we proposing to. So let's take a look at where we stand. Money in the bank at this point. General fund should not be a surprise. We've been talking about this time and time again. This is as of a few weeks ago. We stand at about $24 million. County road fund, that flexes in and out with CHIPS money as it comes in, as we spend it down. Same with machinery. Solid waste is doing surprisingly well, but we've got that $300,000 scale house that's coming out of that. We're going to talk more about solid waste later. And then the hospital gave us an updated figure that's updated as of a week or so ago. Workers' compensation fund is still strong. Health insurance fund, much weaker than the last couple of years we've been here. We're going to talk more about that as well. And you'll see our capital account looks huge, 19 million. That's because the bond money's sitting in there as we pay off, we pay for the project as the construction gets done. That account is going to get drawn down, right? So let's look at general fund balance. If you look at, this was not intentional, but this is since I've been here. So we didn't do so great my first couple of years, but you'll recall that was the year that we paid for JCC in cash, right? And then we paid for the IGT catch-up, which kind of came back in all at once with the hospital. Since then, we have built back up. The pandemic years, obviously, no surprise there. We've been talking about that. We just didn't spend really a lot of money during those years. So that's where we sit with general fund. Let's look at the budget summary. This is where I project, we're going to be when that budget arrives on your desk on November 1st. You've got total appropriations about $59 million, total revenue about $38 million. That's internal revenue, right? And you've got the levy, okay? So 20 million, we've got to come up with taxes. We're going to use about $1.8 million of fund balance. That brings the tax levy to $18.7 million. And that brings our rate. Can you guys see that bottom row with the chairs? The rate becomes 7.54, which is the same rate that we've had in the past. So no tax increase. I think that's the important thing. Jeff, I told you I was 90% certain. Now I can say we're 100% certain. No tax increase next year. But really, I think, the story of this year's budget is twofold. I think the full taxable value is kind of mind-boggling at this point, if I'm being honest. Our year increase, October 13th, 2021 to October 13th, 2022, our full value, all property in Lewis County, the assessed value went up by $136 million. That's a 5.8% increase in 1 year. Eric and I looked at the data, we talked to Candy, we did have 2 towns do revals, but that certainly does not account for $136 million. So, we have to assume, I think, that part of that is we've got people investing. I mean, drive down West Road right now, you've got 5 housing starts. Drive down, Mackey Road that we just paved, looks unbelievable. We're gonna have, I bet in the next 5 years, we'll have 3-4 more houses built out there. So, people are investing and building in Lewis County.
I think on that, Ryan?
Yeah.
Going back to the general service, the report from Ward Daily, there's $42 million in permitted projects out there.
So there you go.
That's huge.
So there you go. So there's 42 million and we're in Lewis County, so how much is unpermitted? But if you look at over the last 10 years, that's, 30% growth in 10 years. I would put that against any county in the state. I mean, I really would. I think that's any rural county, okay? I think that's pretty good.
Ryan, I don't know if you've got the dollar in there, maybe it's on your next slide. Yeah, so that really drives our property tax almost $1 million.
So we don't change the rate at all. We changed, sent out the same bills we sent out last year because the properties are worth more. That gives the county, it equates to about $980,000, that we have to run with, to operate without raising rates. So this is a huge piece of keeping stable tax rates, which I can say we should be very proud of. We have kept our tax rates very stable, very stable. If you look at the last 5 years, we've gone up 5 cents in the last 5 years. That's not bad. If you look at the last 10 years, we're still down compared to, what we were charging in 2014 and 15. 16, 17, I believe one of the big towns, Krogan, maybe did a reval that, draw down the, our use there a little bit. But I mean, overall, I think the taxpayers of Lewis County, when they get their county tax bill, they should know that it's consistent. They should, be seeing similar things year after year. I think that's a sign, in my opinion, of good government, consistent tax rate. Sales tax is another huge story. This is another one. Eric and I have been brainstorming, where this could possibly come from. Last month alone, the month of September, we collected $2.6 million in sales tax.
Online sales.
A lot of, online sales we didn't have. You can really see the difference here in 2018 to 19. Look at kind of 14 to 18, fairly, stable, right? 19, 20, 21, 22, that was after the Supreme Court case allowing us to collect online sales tax, right? So before 2019, you didn't, was it 19 or 18? Do you remember?
19.
I think it was 19.
Yep.
Before 19, you bought something from Amazon, you didn't pay sales tax to the county. Now you do. And, that makes a big difference for us. So if you look at last year, we budgeted $11.8 million, we collected $15.6. If you look at 2022, we budgeted $12.8. So Eric and I are thinking, all right, we got to push this. We got to You know, we gotta be more realistic in our budgeting. And we have not started Q4 yet, and we are at 13.7.
Yeah,
So,
we put in that 14,750,000 for next year, probably a month ago.
Yeah.
And then again, the results from September were very surprising. So, I mean, that's even still conservative, I believe. We do have to think, and Ryan might, maybe was gonna say this next, but we do have to realize, you know, the economy, interest rates, possible recession, we do have to be very cognizant of that for the future going forward. But the results the last 2 or 3 years, I hope that will be a conservative number.
So we have hit, 14.7, we hit that in 2021, we're certainly gonna hit it this year. If you can hit a number 2 out of 3 years, I think you're pretty safe, trying to hit it at least a third year. I mean, we could hit up to $17 million this year, frankly. I mean, this is third quarter, the fourth quarter's holidays, and we haven't even collected that yet. So, another point about sales tax, we have been conservative. So look at the difference between blue and green, right? Every year you'll notice that, we budget conservatively, receive more. I think that's a good philosophy. I think we've been maybe a little too conservative. This is sales tax collected above budget every year for the last 10 years, okay? So since 2014, we've collected $13.9 million above expected. So you get a budget delivered on your desk in November saying we need $12.8 million in sales tax to break even, and we're routinely getting, 13, 14, 15. We're getting above what's in the budget. I don't know what to do about that because we've gone through some volatile times. I mean, we wanted to be conservative during the pandemic. Heck, all the businesses were shut down. We didn't know that online sales were going to take off, right? We certainly didn't know inflation was going to take off afterwards. So it's a tough thing to pin down, but we're on the right side of it. I mean, you guys hear me say the same thing every year. I don't want to be the one. There's always one in the paper. There's always one in the region that overestimates sales tax and is scrambling. You can tell by this, that's not going to be us. Notes on sales tax, pretty much just exactly what Eric just said. This is our most volatile resource. It can go up and down. We got to be very careful about how much of our budget we put in the hands of sales tax. One good note on sales tax, additionally, is that as of last year, New York State has ended the diversion of local sales tax. You remember they were taking money for the Distressed Hospital Fund, and they were taking money for
The municipal, 8 municipalities.
those programs have ended with Governor Hochul, so that's good. State mandates, obviously that continues to be a big driver of cost. So if you look at the tax levy, the property tax bill that's going to be sent out to residents, still 13 million out of 18 million are programs that are mandated by the state. It doesn't mean that if we didn't have probation, the county wouldn't do it, but we don't have a choice. The state says we have to do it. So state mandates still drive a large portion of the levy for New York State counties. Let's talk about health insurance because it is one of the largest bills that we have and that we share with the health system as well. So this is quite the story we've got here. This is the fund balance, all right? So you go back to Q2 2017, we were at $1.1 million in that fund balance. And that's when some folks got panicked and worried that we weren't going to be able to make premium payments and that claims was going to outpace what we're bringing in premiums. So at that time, there was a big hike of rates. In fact, the policy was 10% every 6 months. That really ballooned our fund balance. So I've got 4 million there because that's the target that we've set. You can see that big divot between 6.8. So if you look at 2021 Q1, that would be the March 2021 where we did the holiday. Okay. So, and we bounced right back. We did another holiday, Q1 of this year, you know, you can see it took a dive. What we have not expected, however, is that claims have really taken off the last 3-4 months. So from, you know, 5.1 there to 2.6, that's all claims. I mean, that is claims where people are getting health care that exceeds the cost of what the premiums are going in, okay? So that's where our, you know, where our fund balance sits. By the way, we've always set 4 million as our target. The actuaries say we only need 1 million, 1.1 actually. So we're still okay, we're still in a conservative position. So we just got this report 2 days ago. Eric and I thought we had the budget locked, then had to unlock it to review this, but the big number here is 14.1%. That is what our actuaries are recommending, that we increase premiums next year, 14.1%. This is the little table that they give us, okay? So you look at expected budget, that's right down the middle. They're looking only at claims. They don't care about our fund balance. They care about our population health, and they care about the claims that they're seeing versus the premiums that they know we have coming in. So they're saying that next year, a median expectation is 14%. If you want to be aggressive, you want to ride your fund balance a little bit harder. If you want to say, I know things don't look so good, but I think we're going to get a little healthier. Our claims are going to turn around a little bit. They've got an aggressive number, which is 7%. And then if you want to be conservative and say, actually, I think things are going to be worse, 23%. Now, Eric and I got a chance to talk with our consultants very briefly. We really need to have, as I mentioned on there, more discussion with the health system, more discussion with CSEA, because this is a big number. But what our consultant said is that, you know, they're getting recommendations right now of 20 to 30 to 40%. I mean, they thought 14% wasn't bad. So, you know, you've got to keep in mind that medical inflation outpaces, you know, Jerry knows this, medical inflation outpaces regular inflation. And if regular inflation's at 9%, medical inflation is probably at, you know, maybe close to double that. So, you know, the cost of medical care goes up dramatically. And as you'll see here, you know, we have been relatively flat with our premiums. I mean, we've had a good run. We had 18, 19, 20, and 21, at least 20, 21, and 22, 0% increase with, you know, some holidays. So actually, you know, we've been able to give some money back. But what we are projecting next year, just to be clear, the plan year begins June 1st. We're not setting the rates now, but we have to put in the levy the money that we need for the new plan, okay? So we're not talking about setting the rates now, but we're talking about planning for what those changes could be. What we have put in initially is 10%, okay? That gives us room to play. So we're not, you know, aggressive, quote unquote, at 7%, but we're trying to hedge a little bit, recognizing that we still have a decent fund balance, and if we have to lean on that, just stretch it out a little bit, we can do that.
So we still have time to see where this goes. GKG, our consultant, went out to their actuary for that report that Ryan showed you. They typically do that in like February or March. We'll have them do that again in February and March, and maybe things have mellowed out a little bit with the claims. So again, we're projecting now. We're trying to, again, budget just in case. Very, very likely we'll have to do an increase, but it might, you know, things might mitigate a little bit between now and then.
Eric, do you want to talk a little bit about the cost, you know, what 10% means in terms of dollars? You and I were talking about.
Right, so including our retirees, we have about $5 million a year we pay premiums into the plan. That's our cost, not including employee cost. So about $5 million per year, at 10% increase, that's $500,000. We assumed, again, this would take effect June 1, so 7 months. So we built about $300,000 into the budget, into the levy, to cover 10% if that's where we have to go. Does that answer what you were thinking about?
Exactly, yeah.
We,
So-
I mean, this again, Brian, I don't know if you connected with Jerry. I know you guys talk a lot. So this is our budget only. Impact on the hospital is even more significant. Then they have more employees and, yeah, so their dollar will be stretched also.
So luckily, the budget doesn't have to be on your desk till November 1st, which gives us a little bit more time to try to hash some of this stuff out. But we've got to plug something in because we know there's going to be an increase in June. We just don't know exactly what that's going to look like yet. I want to take a moment to focus on cost to employees because this is getting frankly overwhelming, the cost of our health plan to employees. So this data here was full plan cost of the PPO, both family and single, okay? This is just the employee's cost, family and single. So if we do indeed do a 10% increase, that brings the monthly premium of the family plan to $628, okay? So $628 times 12 months is $7,500 a year. And as we talked about, when we talked about the retention program, the median, not average, median employee salary is $48,000. So 7,500 out of 48 is 16% of gross income, gross. That's before taxes, before retirement. That is staggering, really, and frankly, unaffordable for most of our employees. The total annual plan cost, if you count employee and employer of the family plan, becomes $30,156. That is an unbelievable purchase of healthcare per person. And by the way, we've made all kinds of reforms. I mean, we have worked with GKG for years. We did the mandatory mail with retirees, right? We've done, prescription drug programs. We've done, Jerry, you remember some of the other programs that we've done?
Biometric screening.
The biometric screening. I mean, we did the prescription drug audit with Excelis, where we paid a company to come in and make sure every drug that we paid for was what it was. And we saved. I mean, we've tried every gimmick to try to keep costs down. But I think actually this discussion goes hand in hand with Ashley's discussion. We have an unhealthy population in Lewis County, period. We lead the state in obesity. We have a lot of smokers. I mean, that is the reality of providing healthcare. So we will talk more about this in June. Well, far before June. We'll talk more about this probably in March and April, okay? But just as a FYI, it's a big part of the budget that we need to look at. Other risk pool items, health insurance premiums, like I said, that's kind of a risk pool item. The IGT, I'm going to talk a little bit more about that later. Medicaid, I'll talk a little bit more about that later. Jail medication assisted treatment and corner expenditures. This goes back to my original point. In the past, we've loaded up these items, okay? In a past budget, if I know that jail MAT is a new program that the county has to do, we'll put in $300,000 because we don't know if it's going to cost 100. We don't know if it's going to cost 400. With a high fund balance, I don't think that's appropriate. I don't think you put in 300 if it could cost 100. I think you put in 200, and if it's more, we'll take it out of fund balance. But let's not charge the taxpayers, right? That's kind of the point. Department highlights. Phil, I'm not going to go department by department. We're just going to hit some highlights. So, public defender, we just approved those contracts, right? So that equates to about $100,000 increase. Contingency and legislative, we bumped each of those up $100,000 each. You guys, we got a lot of initiatives. We got a lot of programs that we're pushing right now. This is a board that wants to get things done, and I want you guys to have the money there to move some things forward. Like I said, well, never mind. Jail inmate board, $35,000 to $200,000. We're moving all of the inmates out for like 2 months, right? When we do the HVAC project. So the sheriff was thinking ahead and has put in money so that we can put all those inmates probably in Oneida County where we're doing that project. Trail security, we've included that again in 2023. Planning, we are adding a new line item for town and village comprehensive plans. We've got very few villages and towns that actually have comprehensive plans, and I think Cassie wants to start pushing on that a little bit. So we're giving them some funds to help some of the towns and villages with consultants and move those along. We've also added $100,000 for the facade program. We've been running them every fall. So next fall will be an opportunity to run it again. We probably won't spend that money until 2024 because it's a fall program, but we want to have it in there, locked in, so that we know we're going to run that program again. But it's not enough, but it won't also be spent in 2023, it'll be spent in 2024. So we'll just have to make sure that we address that
And
next
the
year.
previous, I think 2 rounds of that we've done have come from ARPA funds, so in this case, we're gonna use our own funds, which not enough, but it's a good start. I think that we're at least using our money to do that.
Veterans, we didn't make it very far on that discussion. I hate to say, I did get a little more information from Jefferson County. At this point, I would recommend we stick with Jefferson County for a little bit longer, kind of see, give them a chance to iron things out, see a little more data, and then we can decide if we want to bring it back in-house. The good thing is we've kept the full budget. So we didn't reduce it at all from last year, full budget. If we want to go back to an in-house veterans, we can do that very easily. Public health, we talked about this a couple months ago when Anna Plotz was presenting, but we do have new line items for suicide prevention and for the crisis response team. It's about $20,000 total for those. Highway, new line item for road sweeping. Tim's going to give a great presentation next month about all the different kind of philosophical changes and ideas they've been doing at the highway department. One of them is, let's not have all of our very expensive labor going around picking up sand for 3 months. Let's pay somebody to help us with that. And so we're adding a new line item for that. Debt payments, obviously new. So we got about $550 that is from the courthouse. That was from 2008. And then we've got our first bond payment for the new project this year. That is, if you think about it, in your heads, that is money that comes from the pilots, okay? So even though it all gets chalked into the budget together, that's basically where our wind pilot money goes, debt payments. 911 dispatch, we had a brief conversation about that last month. What I'm recommending at this point is no personnel changes. When we have retirements or whatever is gonna happen, we'll address it when it happens. Department highlights, DSS. See, they get their own department highlights, Jenny. Foster care revenue continues to trend down. We talk about this pretty much every year, but foster care is a block grant, and the counties around us in our region have a lot of foster care needs, which means our piece of the pie gets smaller every year. On the same time, we're increasing rates to providers, which we need to do because it's critical that we maintain those relationships and have safe, experienced homes for folks to go. TANF, 24% increase. We're going from 300,000 to 400,000. In the conversations we had with Jenny, we talked about the eviction moratorium is up and rents are really going up quite quickly. So people that may need TANF, temporary assistance for needy families, or the safety net program is likely to increase. So we've tried to give ourselves a little more cushion there with both TANF and the safety net from 300 to 350. Two good things for youth employment. We talked about the postgraduate fellowship. That was part of our American Rescue Plan funds. That's going to be instituted in 2023, as well as enhanced summer youth employment. Andrea, I think you're one of the ones, we talk about this every year. Why don't we have enough for the kids that come through the door? Well, you know what? Why don't we just come up with a little extra money and try to help more kids? So that's the plan with that. Now we get to my favorite slide. This is called the Jenny.
My picture there.
Because this is the I told you so slide. Because Jenny wanted more money and I cut it back. And if I'm wrong, then she gets to say, I told you so. IGT and Medicaid, those are the two things we talked about in the risk pool, okay? IGT, if you look at the history there, right? Look at 19, 20, 21, 22, you know, that has been anything but consistent, okay? And we haven't done a good job predicting it. So we just keep taxing the people of Lewis County for a $4 million expenditure that in the last 3 years has been typically less than 2. So if it does come in at 3 or 4, fine, we'll go into the fund balance, we'll address it. Let's not keep putting it on the levy, right, for something that we don't know if it's gonna come. Medicaid, we know Medicaid's gonna increase, we certainly do. During the pandemic, they had the enhanced federal assistance, okay, that reduced our Medicaid weekly share. That's going away. So we know that our number is going to climb back up. So if you look at 19, it was 4.8, then it goes down 4.6, 4.2. That's going to go back up to at least 4.8 because it's going to return to pre-pandemic levels without that enhanced FMAP. And we have increased enrollment in New York State. I mean, the state's philosophy is they keep expanding Medicaid eligibility. We know that. That's what they're trying to do in Albany, which means the county's share is going to continue to grow. Whether it grows to 5 million or 5.8, I'll buy Jenny a beer if it's 5.8, but we're going to park it at 5.2. And if it's higher, then again, we'll have to take that out of fund balance. Solid waste. I took this first quote directly from last year's presentation. Dank tip fees will be increasing 6.8% effective 1/1/2022. This budget, meaning last year's budget, is built to absorb that increase without changing our fee for now. I didn't add that emphasis. That's literally what I wrote last year, for now. Well, Dank went back to the well. They're increasing tip fees again in 2023, another 6.4%. At that point, I don't feel the county really, should be that out of balance with what we're paying Dank. So what we're recommending is a 7.1% increase, which equates to $6 in our municipal solid waste tonnage, okay? That brings us up to $90 a ton. I did a little research. Jefferson County is at $123 a ton, and St. Lawrence County is at $166 a ton. So I think even going from 84 to 90, the haulers and residents of Lewis County are getting a decent deal. And we still have not gone up as much as Dank has gone up, right? So if you remember, haulers bring it to us at the transfer station, we then bring it to Dank, okay? So we've got to make more than what we pay Dank or else we can't fund our operation. So that's the margin that we're counting on, that we believe we can fund our operation with.
Yeah, no, I think, again, I think this year we are seeing a little decrease in our fund balance, in our revenue versus expense, because we didn't cover that increase last year. So with 2 years of increases from Dank, I think we do need to keep up.
Speaking of fund balance, we hit a peak in 2020 of over $1 million of fund balance. Now we're running about a 1.3, now 1.5 annual operation. So 20% would be about $300,000. 20% fund balance on an enterprise fund is more than sufficient, okay? So we started at about $1 million. We've obviously drawn down because we've done some projects. I mean, we did a $1.2 million project up there, right? And now we're doing a $300,000 project. And so the 1.2 million, you'll recall, we basically borrowed from the general fund, right? So we have to pay that back. The $300,000 for the scale house, we're paying cash, okay? So we're paying that right out of our account. So as it sits right now, we're at $687,000. By the end of the year, I project that we'll be around 300. I still think 300 is fine. A $300,000 fund balance at the back end of huge capital expenditures is safe, okay? And we looked at cash flow too. We think they're gonna be fine to pay their bills and whatnot. So, and as of January 1st, if, awaiting your approval, they'll get a lot more from their solid waste tonnage anyway. So that's where we sit with solid waste fund balance. They're an enterprise fund, right? So they have their own fund balance, not part of the general fund. General notes, I I think I forgot to take this out. This is from last year, sorry. Non-departmental agencies, this is where we contribute to organizations outside of the county government, long tradition in Lewis County. Highlighted are the ones that are different or notable. Advocate Drum, the Fort Drum Regional Liaison Organization, has asked all 3 counties to step up. They have been trying for years to get enough money from the state of New York to hire an executive director. They have not been able to get that commitment from the state, so they're asking the local counties to step up. Jefferson County is increasing their contribution as well. The goal is that locally, between the 3 counties, we can fund this for them to have somebody full-time that can help us, keep track of what's going on post, make sure that we're advocating appropriately at the state and federal level for Fort Drum. It's a pretty critical piece of the North Country economy. And so that is their request, which I feel this year we have enough resource to be able to honor. Double Play Community Center, that is a typo there because their 2023 request, I think they had put in $100,000, not $20,000. But I think we can afford to give them a little bit more, up to 40, certainly not 100 yet, but we can get there over time maybe. Everybody else is pretty much the same. Credo, you'll notice, is new, but it isn't. It used to be buried under Pat's budget, and we excavated it and put it here where it belongs. So, Lewis County Humane Society is one that had never written to us in the past, never asked for any funds in the past. They did write to us this year requesting, I believe, 10,000, but we can match them at 2, where everyone else is, the community organizations, museums and such. Same with the Old Time Fiddlers Association. They've never written to us requesting funds, but they're a museum just as much as everybody else. So I plugged them in for $2,000. Capital transfers, this should look familiar. It's the exact same spreadsheet we handed out last month, but just a reminder, we've got $1.1 million of levy money going to capital, and then we've got $2.2 million for fund balance that we're going to use for the West Road culverts and the PSB parking lot. So, all said and done, did we hit our 3 fiscal targets from 2015? Yes, we have, which, by the way, I think the Finance and Rules Committee might want to think about some better financial targets. These are pretty easy and we can do better. Questions and discussion. I put some issues up here, to kind of prime, but, if there's anything in particular you guys want to hit or discuss, now's the time, because this is your last chance for feedback before the budget, arrives on your desk. From there, you can change it, but you have to change it by resolution. So it's better to talk it out now than have to have a resolution. Dick?
Yeah, Ryan, on the FPRL proposal, the last time around, they raised that stuff. It was noted that Jefferson County receives a heck of a lot more money out of Fort Drum than the other 2 counties did.
Yes.
So did they ask us for the same amount as Jefferson County, or?
No.
Okay.
They asked us to go up to 50, they asked Jefferson to go up to 100.
Is Jefferson going for 100?
I haven't seen the budget yet.
Thank you.
Ryan, could you go back a few slides to the disbursements for non-county departments?
Sure.
Looking for one more, right there. I think we should consider meeting the request for Cornell Cooperative Extension. And in disclosure, I'm on that board. I'm the county's liaison for it. And I don't know if maybe there was more you wanted to share in that, Ryan. I was in when they did their budget workshop in that meeting. They've done a lot of really great work for the county. Needless to say, they've stepped up in the last few years. 2 things that stood out to me. One was their connection with the Amish community during COVID-19. And in that capacity, they operated as a quasi-government agency through whom our communications were going to make sure everything was okay with them. And they still continue to fulfill that role. And the other thing too, with the expansion of the child, what's it called, the parenting coordinator?
Yeah.
I think it is. They've taken up a lot of the cases that fall through with DSS or just where maybe it doesn't fit their particular mandate or what they're needing to do. A lot of those cases are going to CCE and being referred at a county court now. So they're really stepping up to fulfill what would normally be considered a county obligation. I think that the requested increase was fairly modest, and I think it was definitely proportionate to the level of services they're providing to the community. It isn't just the ag stuff, as important as that is. They're really doing a lot of county functions.
No doubt. And I'll add another one to that list. The Ag Sustainability Committee that we put together that Andrea has sat on, I mean, they've pretty much led that initiative. I think the world of Cornwall Cooperative Extension. I think Michelle and her team are phenomenal. They are the largest organization that we contribute to. We did an increase, I believe, last year. I'm fairly certain we went up for them last year. My thought was we've got a pretty big disparity between them and some of the others. And so, you know, that $36,000 or $16,000, you know, I thought could be distributed, you know, double play, for example, in FDRLO, but, you know, I have no dog in the fight. I mean, I'm certainly open to, you know, we can increase the budget $16,000 at this point and not affect the tax rate.
That's a 5% increase, just to keep that. I mean, you know, that keeps pace with inflation and increase of wages. And they don't, unlike, you know, double play, they don't really have other sources of income. They've got the county, they get some state grants, but I mean, we are by far their biggest funder.
Yeah, no doubt. A lot of their programs are line item funded in the state budget, so they're constantly at risk of, you know, ending or, you know, phasing out or whatnot, so.
What does double play?
They're the community center that operates in Lewis County. They've got the teen and community center here in Lowville. They've got a workout facility in Lowville, and they operate the summer rec programs. I believe in South Lewis, Lowville, and I don't know, do they staff one in Beaver River? No, so they do a couple summer rec programs.
I would think that's more of a local Loudville than, you know, I would agree with Ian that the cooperative extension benefits the whole county. Or that's, double play is really a local Loudville community that doesn't really benefit the entire county. I'm just saying that.
Yeah, that's fair. I think they're trying to have that reach. I mean, the numbers, you know, I guess, you know, kind of going back to what Ashley said, my thought process is we really need to invest in some healthy activities for folks. There's not, you know, much going on in terms of, you know, folks that are trying to do healthy mind, body, you know, wellness stuff. So, but it is, you know, I don't know how far the reach. I don't think the reach gets to Westlight and Osceola. Probably not.
Maybe one other point of information that I think Ryan and REACH had been asked to assist the Village of Lowville Summer Recreation Program this year, which Double Play operates. So we saw some information on participation at the Village of Lowville Summer Recreation. It was 25% or more of their participants were outside town residents. They were not Lowville town residents, so.
Eric, I think what I saw was closer to 40%.
Yeah, you might be right, Dick, sure. I mean, I think that's the case, you know, obviously the summer rec program in South Lewis, I think Copenhagen has one. They're not just centered in those village, you know, residents.
I think if there were other, you know, health and wellness things going on, I mean, if there were other things to fund, I think we should fund them. I just don't know if Double Play is doing anything.
So would the increase go towards their anticipated purchase of the larger facility?
It would go towards whatever they want to put it towards, and we don't really limit any of these folks.
Are you anticipating that would go towards, would that help towards?
It would probably help them break even on whatever project they're moving forward with, yes. I mean, 20 grand one time isn't gonna make a huge dent in their capital costs, but sustained over time, you know, can help offset and they're not for profit. I mean, they're not making a lot of money, so.
Are they anticipating
Oh,
a new facility? a
They got a
different
couple,
facility.
they've got a couple irons in the fire, yes. Yeah. Not the one that we talked about a while ago, the brand new
Right.
$14 million, but they're scaled back to some other options, yep.
Right.
Yes.
If I could, one other thing, we talked or had discussions a while ago. I know we've got a warming center for this year, or we got that solved or something. But looking forward, just bring it up as a thought for, there's gonna be another winter next year, so. I didn't see that in here, so it's probably in one of the.
Well, the code blue money is built into the DSS budget.
Okay, so that-
But in terms of our larger initiative regarding homelessness and affordable housing, we're hoping that those capital expenses are going to be grant funded. There's a lot of money at the state level and regional level being pumped into to affordable housing and homelessness. And we're hoping that the capital expenses will be covered. Developing an operating budget after that will probably be something that is a job for 2024. I don't see us having something built, open, and operating by the end of 2023, but we probably will have to contribute to that operating cost. I mean, there's ESHI money that's gonna help us with the operating, but I imagine there'll be some.
That the application for supportive housing funding will be in by next week for the 2023 year, which brings us in operating capital. If we get that approval, and then that helps us get the bricks and mortar funding through HHAP. So we're finally moving on submitting for some of these grants to try to build something. It's probably not enough.
Yeah.
There's a huge need, but that'll be outside state funding.
Okay,
State
thank
funding and not the local share.
So that's a good point, Dick. We've got, not only that homelessness initiative, we've got the EMS initiative, we've got the Central Louis Water Study, water initiative, we've got the Ag Sustainability Initiative. That's part of the reason why we doubled the contingency accounts, so that when something does come up that we want to keep that ball moving, we've got funds to do that, basically. So. Tax rate, I know there's not a lot to talk about when we've been fairly consistent, but, thoughts or musing on that. I mean, we did reduce fund balance usage a little bit to balance the budget. That'll give us a cushion next year to balance the budget, hopefully. But, it's unlikely that we're gonna be able to keep this pace up forever of never, not raising taxes consistently. I mean, eventually we probably will have to do that again. General fund balance, we've talked a lot about, what we're doing with that. Like I said, homeless housing, water infrastructure. So, anything else?
And one last thing, and then I'll let you get on, but it should be noted, we've done this no tax increase without cutting any services.
Yes.
So that's another piece of that pie. That's
Yep.
where people have to go to the next just cut services. So I think it's important to note that we haven't had to cut any services until so.
No, in fact, I think in some areas that the legislators have shown, we're lacking some resources. I think we've been able to bump things up a little bit. For example, the summer youth employment, 30,000 isn't the end of the world for us, but it's gonna help, 3, 4 more kids, 4 or 5 more kids, have an opportunity with the county. So I think those are good initiatives.
I think a sort of not directly related conversation Ryan and I were having just a couple days ago is about, I'm not a fan of growth in government, for sure, but with growth in our property tax base, that means there's more economic things happening, there's maybe not more people here, but there's more people coming here.
Yeah.
Whether they're only here for a couple of months, if they're at their second home, or if they're visiting for ATV. So there's a demand, there's probably an increased demand for services. We haven't increased employment, we've not cut services, but I think we have to be cognizant that we might not always be able to do that. Codes enforcement, I think Josh quoted the number, I mean, they're busy, they are very busy. So if you have to add a codes officer, you do. And the tax base, in theory, supports it because that number is going up.
I've had a philosophy from day one here that we need to be prepared for the demographic collapse of Lewis County. We're getting older by the day, okay? And our housing stock is getting older, that's a huge risk. Maybe philosophically, we need to watch this for a few years. Maybe our philosophy needs to be, maybe we need to hold the line a little bit more because maybe our full-time population isn't growing, but clearly the people that are spending time here, investing here is increasing. So, it's a very different philosophy. We have in the, few years that Eric and I have been doing the budget, this is the sixth budget that I've put together for the county. We are net down in positions. We are, probably, close to 10 positions we're net down, okay? Because that's been our philosophy. We gotta keep government in a box because population is going down. It's gonna become harder and harder for people to pay for these services. But, people are investing in other ways. The best case scenario is somebody comes here, builds a house only to visit seasonally, doesn't require any services, doesn't need a kid in school, doesn't need probation, doesn't need, that's a pretty good deal for, the rest of the taxpayers that are here full time, So, anyway. Thanks for your time.
Larry and I think that we could help the obesity problem quite effectively by more hunting. Would you concur with that?
Sounds good to me. Ashley should weigh in.
It'd be low cost, actually.
She can't win this one with her husband. See, you said it was good for her.
Ryan, just wanted to say that this is a ton of work and you make it very digestible, you all do, so
Thanks.
I appreciate being able to understand.
Yeah, I guess we have to say well done.
Thank you.
Anybody else got questions for Ryan? Or Eric, you want? I guess we'll go to topics.
The first docket is adopting local law number 6-2022, a local law providing for one-time employee retention incentive payment for certain exempt and appointed employees.
Any discussion? All in favor, aye? Opposed, nay? Okay,
Setting the public hearing for comments on the 2023 tentative Lewis County budget for Tuesday, November 22nd at 5:00 p.m. in the second floor legislative chambers of the Lewis County Courthouse.
any discussion? All in favor, aye? Opposed?
Authorizing renewal agreements between the County of Lewis and various media entities for planning department's public transportation advertising and marketing campaigns, with Spectrum running advertisements from January 2nd, 2023 through December 24th, 2023 at a cost of $8,710, and WWNY 7 News running advertising from December 31st, 2022 through December 31st, 2023 at a cost of $15,008.
Discussion? All in favor? Aye.
Setting additional advertising opportunities and rates on the Lewis County public transportation buses and bus stop shelters.
Any discussion? All in favor?
Authorizing renewal agreement between the County of Lewis and Advance 2000 for support and maintenance services for the Lewis County telephone system at a cost not to exceed $22,275.32 for the term of January 1st, 2023 through December 31st, 2023.
Discussion? All in favor, say aye.
Aye.
Opposed?
Approving grant applications to Federal Emergency Management Agency Building Resilient Infrastructure and Communities funding to update hazard mitigation plan for an estimated total project cost of $150,000, with the local share to be $37,500 and $7,500 for grant management and for scoping of East Martinsburg Road, with estimated project costs still to be determined.
Any discussion on that one? All in favor, aye?
Aye.
Opposed? Passed.
Authorizing application for New York State DEC Organics Reduction and Recycling Grant Program to develop a Lewis County Organics Waste Management Program consistent and in support of the county's designation as a clean energy community, with estimated project cost to be $48,000, with $12,000 as the local share cost.
Discussion?
What are we doing? Ryan, do you know? What's this?
Prefer to have Cassie answer.
So we're developing an organics management or organic waste management plan, so that's part of this package. And then we're going to work in educational outreach components, and then a residential program for a small scale organics waste management plan. And then hopefully within that organics waste management plan, we can identify a larger scale composting effort that the county can contribute or to be part of.
Well, a lot of counties have at
Yeah.
their solid waste facility, like composting. We don't have any of that here in Lewis County. So start building blocks to see if that's feasible, I guess.
So this is or could be a part of a bigger package?
That's right. Yeah, and I've had preliminary conversations here, but I've had preliminary conversations with Kip about this and the possibility of putting something larger at the solid waste facility. And this has been something that's been discussed by Dank. They just don't know how to do it. So we're hoping to be able to identify this in the plan. And the $12,000, just to know, our intent is to have that fully paid for with in-kind services to our department and to Delaterra. But there may be, a couple thousand that's out of our team development.
Say that again about who's gonna pay for the 12,000. You kind of mumbled on that part there.
We'll just work that out in our department during kind services. That's our expectation at this point.
It won't be cash.
Yes, we're hoping to not have to use any of that with cash.
Oh, okay.
And also, this initiative goes towards our clean energy designation points, so.
Yep. And it helps build our certification towards the climate smart community ROM certification. So it's all part of the same.
Okay.
I think so.
Any other discussion, comments? All in favor? Aye. Opposed? Passed.
I do have one motion. It is a motion to authorize Information Technology Director Connor Bielsi to submit an application to the U.S. Department of Homeland Security and FEMA for the fiscal year 2022 state and local cybersecurity grant program to improve critical infrastructure security and resilience of government services with a 10% local match.
How much would we be applying for, Connor?
Up to 100,000. Because they'll fund up to 90,000 of it. But I have not identified yet what we'd spend it on. It's just, you gotta get the application in and then you decide what you're gonna pay the money. So it's working on it.
Get the money and then figure out how to spend it.
Yeah.
Okay.
There's definitely ways to spend it. Cybersecurity, as we've talked about many times, there's always stuff to throw money at that can only help. So it's just deciding what one's gonna be best for us and what one's gonna be, not too high on the operational cost in the long term.
Cyber security is the focus.
Big time.
I'll make that motion. Second. Anyone? Jeff? All in favor, aye? Aye. Opposed? Passed. Brian, anything else, or are you done?
I am done.
Surprised you haven't gone long as you did.
I am too.
I don't think it was 45 minutes, was it?
If Tom was here, it'd been different.
Maybe 50 minutes.
Getting ready to adjourn?
Apparently, we're gonna get ready to go into executive session. Is that right?
I'll wait till then.
Yes, and that would be for me to update the committees, all of the committees on contract negotiations for potential property.
Anything else before we go into executive session? Dick, is there? Need a motion to go into executive session. Jeff. Second. Josh. We're in executive session.